Postpartum Health Teaching and Going Home Instructions by Jamabel Galindo.
Good day, ma'am. My name is Jamabel Galindo, a student nurse from Central Philippine University, BSN 2D. So today I'm going to perform the postpartum health teaching and newborn going home instructions. So she's my patient, improvised patient. Good day, ma'am. I am Jamabel Galindo, student nurse from Central Philippine University. So may I know your name, ma'am?
Hello, nurse. I am Prexy Braille Ann.
Okay. Mrs. Prexy Braille Ann. So, date of birth, ma'am?
April 17th, 1995.
April 17, 1995. Okay. So today, ma'am, I will be doing a health teaching to you and going home instructions in preparation for you to take your baby home. Congratulations, Mrs. Ann, to you and to your new baby. This is a special time in your life, and I would like to take a few minutes discuss with you about how to take care of yourself and your baby.
Okay, nurse.
So let me begin, ma'am, for the first 2 weeks. For the first 2 weeks, make sure to rest and recover as much as possible. Also, ma'am, eat well, healthy foods, and I am encourage you to drink enough water to hydrate yourself, and getting enough sleep is also important, ma'am, and because it can help prevent postpartum depression. So try sleep when your baby sleeps. So this is a very special time when you need to focus on the needs for you and your baby. If possible, have people to help you at home with household chores like cooking and cleaning. And after the first 2 weeks, gradually increase your activity. So you may notice that vaginal bleeding often increase with activity. If you will notice some vaginal bleeding, it is your body way of saying you need to rest, ma'am, because you're doing too much activity. So bleeding may occur for 2 to 6 weeks postpartum. So for the first two weeks postpartum, you also shouldn't lift anything heavier than your baby, ma'am. Then, carrying your baby in the car seat is too heavy. Please have a support person that is available to help you, and be cautious on how you bend and lift. Next is you should call your provider to have a follow-up appointment scheduled for 6 weeks after the baby birth of the baby. And for the next 6 weeks, do not put anything on your vagina unless stated by your provider. So discuss with your provider the many options that you can use for birth control, because unprotected intercourse may result in pregnancy and also infection. So you can resume intercourse after discussing this with your provider. Then, ma'am, so for the breastfeeding, take your prenatal vitamins and multivitamins daily as long as you are breastfeeding. And also, ma'am, you can continue even your bottle feeding. It is important to check with your health care provider prior taking medications, even over-the-counter medications. It is important for you to call your provider if you have fever at least 100.5 Fahrenheit or 38.1 degrees Celsius. If you have abdominal pain different from cramping or after pains following the birth, heavy vaginal flow, foul odor, and passing the multiple small clots or large clots. And if you're C-section, ma'am, and you notice redness, pain, drainage, and stitches pull apart, call your provider immediately. So, day 2 to 5 of postpartum, you may notice, ma'am, that your breast will become larger and heavier as your milk comes in. If you are breastfeeding, having the baby feed frequently. And it is also important to wear a sportive bra, use moist, hot compress prior to breastfeeding, and using ice packs such as frozen vegetable bags after nursed will help the fullness. If you're bottle feeding, it is important to wear a supportive bra and use ice packs to your breast to help relieve pressure. And when you shower, have the water face your back and have no stimulation to breast for approximately 1 to 2 weeks if possible, ma'am. And ma'am, if you have experienced pain or redness in breast with fever or flu-like symptoms or excessive nipple soreness, it is important to call your provider also, ma'am. After the birth of the baby, you may go through a period of emotional changes. You might notice that you may be more emotionally sensitive and be weepy at times. This can be known as postpartum blues, and it is normal, ma'am. So the postpartum blues can last up to 2 weeks postpartum. However, ma'am, if you have feeling of not wanting to get out of the bed and face the day, if you will experience anxiety, not eating, can't sleep, disinterest in the baby, sadness, hopelessness, and depression that lasts more than 2 weeks postpartum, contact your health provider, ma'am, immediately. And also, ma'am, if you wanted to harm your baby, make sure to contact your provider immediately because that's a sign of postpartum blues. So now, ma'am, for the hygiene, it's important to wash your hands before and after using the bathroom, when changing baby's diaper, when cleaning your peri area. Use water bottle that given to you in the hospital to clean from front to back and pat dry with toilet paper, diaper in the same manner. So, ma'am, if you have incision, clean the area daily with warm soapy water, dry your incision thoroughly, and keep incision clean and dry. Make sure to wash your hands before and after touching the incision to prevent from infection. And so, ma'am, we will proceed next to safe sleep of baby. So place your baby sleep on your back or on a firm mattress with fitted sheet. Keep area free from anything that can cover their head while sleeping. So, ma'am, no pillows, no stuffed animals, loose blanket, sleep positioners, and crib pampers. And also, ma'am, do not allow to sleep in the car or swing sofas, armchair, and beds with other adult or children. It is recommended that the baby will sleep in your room on a separate surface for the first year of life, and offer pacifier at nap time or bedtime to help reduce the risk of SIDS or sudden infant death syndrome. So if you are breastfeeding, avoid pacifiers until breastfeeding is well established, ma'am. Then we will go to the ways of comfort your baby, ma'am. So if your baby, ma'am, can stop from crying, you carry the baby, walk and talk to your baby. Then swaddle your baby in a blanket and wrap the baby gently, or use a baby swing if you're not used. And if you notice noisy breathing or the baby is breathing faster than normal, difficulty in walking, your baby, jaundice that is spreading from face down to the chest, pale or mottled skin, swelling redness, warmth, or drainage of the pus from the umbilical cord site, temperature less than 97.9 or greater than 38.3 degrees Fahrenheit if the baby is vomiting more than occasional, or if there is a green or blood vomit, and if sudden changes in bowel movements along with irritability, poor feeding, and diarrhea. Don't be confused to call your provider immediately. Then, for the diapers, ma'am, a breastfeed baby should have 4 wet diapers, and for dirty diapers by the 4th day of life, while a formula fed baby should have 4 wet diapers and 1 dirty diapers by the 4th day of life. Lastly, ma'am, for the breastfeeding, exclusive breastfeeding for 6 months may continue until 2 years old. And beyond, frequent sucking produce more milk for breastfeeding problems, ma'am. So, you may visit also the lactation center, the lactation station, or Iloilo Mission Hospital breast buddies at home at phone number that I will give to you later. And for bathing, ma'am, daily bath using mild soap and lukewarm water, shampoo in the head, first rinsing with clear water, wash the baby from the face down using only water on the face. So dry your baby thoroughly, especially in the crease of the arms, legs, and neck for the cord care. Keep the cord dry after patting, so no need for abdominal binders and oil. So, ma'am, for the sunlight exposure, expose the body to early morning sunlight, 15 to 30 minutes daily between 7 to 8 a.m. For newborn screening, official newborn screening result is released after 1 month, ma'am. And you can get it at NBS office every Monday to Friday, 8 a.m. to 4 p.m. So for those with abnormal result, will be notified immediately, and that's because it is not normal. So that's all, ma'am, for today's health teaching in postpartum and going home instructions. And thank you so much for your preparation, and congratulations again for the opportunity of caring of your baby. Hope you are elated and satisfied with our services, and we will happy to serve you again. And please bring in charge instruction upon clinic follow-up.
Okay.
So,
nurse.
For the phone number, ma'am, here's the phone.
As if keeping it.
So, thank you so much again, ma'am. So, hello, ma'am. I am done giving health teaching and newborn going home instructions to my patient. That's all. Thank you.